Well, good afternoon, everyone, and welcome to your Benton-Franklin Health District Board meeting. Today is Wednesday, April 15th, 2026, and the time is 1:30. And we'll start with the agenda and approval of the March 18th, 2026 regular Board of Health meeting minutes. Do I have a motion, a second?
Mr. Chair, I move that we approve the meeting minutes from March 18th.
Thank you. Got a motion? Second. And a second. All in favor signify by saying aye.
Aye.
Aye. Sounds like the motion passes. We'll move down to public comment. Is there anybody in the room right now that would like to do public comment? Seeing none, we'll go online. Is there anybody online that would like to make a public comment?
If you're using the Zoom app, you can raise your hand to comment, or if you're on a phone, you can press *9 to raise your hand.
You pull up the participants list just so we can see. Thank you.
Seeing anybody? Seeing none? I am. Seeing none there, we'll go ahead and close public comment. And we'll move down to item number 4 as we're rolling right along to director comments. Are there any director comments?
Nope.
Oh, come on.
I'm on the agenda enough to
All right, we'll move down to item number 5, unfinished business, and there's none there, so we'll move down to item number 6. And then new business, and that's number A is Office of Health Officer update. Dr. Krager. You are up, sir.
Thank you. Good afternoon, everyone. It's good to see you all. I'm going to keep my comments very brief today. I don't have slides. Just one thing I want to touch on. We have a lot of presentations from staff, so I want to give them time to give their presentations as well as you all time to ask questions. So I'm going to keep my stuff brief. I know we've talked about measles a lot, but I had the pleasure of dealing with a measles case in Walla Walla, our neighbor, about a week and a half ago, that we're still, kind of working through. And it's just an interesting, public health challenge when those things come up. It's one thing that I've noticed that is a big challenge, both for us as well as just the general public, is finding your vaccine records, which, a lot of people know they've been vaccinated, or thought they were vaccinated as a child. But there's this significant gap, mostly around middle-aged people where they probably got vaccinated, but it wasn't at a time when we had a lot of electronic medical records. So we might just have that like physical paper copy, and hopefully it got scanned somewhere or somebody noted it in an EMR at a certain point. But there's a lot of people that it can be a challenge. And from our standpoint in public health, that we look at whether people were exposed to measles, and then we try to figure out if they're immune or not. And vaccination is obviously one way. If you had previous measles infection, if you cannot find your records, you can get what's called antibody titers and that we generally accept that as evidence of immunity. But that's just one little wrinkle that comes up as we're scrambling, trying to find everyone, see if you're immune, and because we have extra precautions for you to take if you're not immune, and we want to watch you more closely to see if you develop symptoms. So all that to say, it's been a learning experience for me, although not the first measles case I've dealt with, but in Walla Walla on this side of the state. And hopefully, again, we'll avoid it in the near future for Benton and Franklin counties, but something we're obviously keeping an eye on. So with that, I'm going to open up for questions or pass along to whoever's next.
I have a question. So what's the difference between measles now and measles 50 years ago? Because I can remember as a kid, measles weren't that uncommon.
Yeah. Yeah, and pretty much everyone. Yeah.
Oh,
sorry. What was that?
I said I had measles as a kid.
Yep.
It seemed like everybody got them.
That's
not everybody, but it wasn't uncommon.
No, and that's absolutely true. And in fact, we consider if you were born before 1957, before the vaccine was widely available and we started seeing a decrease in rates, we just consider you immune because everyone pretty much did get measles. I think there's not any significant difference in like what the measles virus looks like, or how it affects people. Uh, but we've seen, since vaccination, a huge decrease in the number of cases. For periods of time in the last 20 years, we've had, a smattering of cases every year, sometimes like in the single digits or around there in the United States, and they're always imported from somewhere else. So what's changed the last couple of years is just more local cases that we have not seen for, again, since the 90s, really. And it's nothing compared to what it was in the 50s or 60s in terms of like volume of measles cases, but the trend is a little bit concerning. And honestly, just from a public health standpoint, like we don't have a lot of practice dealing with it. We know what to do. It's very similar to kind of how we approach some other infectious diseases, but it's very contagious, and it just takes a lot of work to investigate a case and try and make sure we contain the spread. It's a good question.
Well, thank you, Commissioner Mullen. Now I know how old you are.
Well, I'm not that old, but I'm not that young.
I couldn't help you. I'm sorry. I know you'll get me later.
Hey,
Go ahead, Commissioner.
Dr. Krager, it's Will, I got a quick question for you on the vaccine. How long does that vaccine last for? Is it like years, like 10, 20 years, or how long does it last?
We consider it lifetime immunity if you've
Oh,
gotten
sweet. Okay.
two. Yeah.
Yeah, because I was bringing it up. I remember getting the chicken pox like 2 or 3 times as a kid, loathing the chicken pox. So I hope I never get the measles because I remember getting vaccinated when I was a kid. So I'm like,
Yep.
oh, I don't want to get the measles either. But yeah, the chicken pox, no bueno.
No, it's no fun. Yeah, measles, if you have two vaccines, even long-term studies, it's 97% effective. So it's not perfect. There's still
Okay.
people that get it, but it's usually even pretty mild, but it's a very, very effective vaccine. Yeah.
Yeah, that makes sense. Knock on wood. I'll hopefully I never get measles. So
Yeah.
since I brought up the chicken pox.
You never had. I had chicken pox.
We used to have chicken pox.
Dr. Krager, I do have a question.
Sure.
Was that case like unvaccinated individual? And then the question is, how did they get the transmission?
Yeah, great question. They were not vaccinated. Yeah, they had no. They confirmed with us that they didn't have any measles vaccine, and we, found no records. They were actually exposed out of the country. So they had, I don't know all the details, but I think they had been visiting family or friends outside the country. One of those people ended up contracting measles. Ideally, honestly, after that exposure occurred, that person would have stayed outside the country, but they traveled back. And thankfully, we were notified. The country they were in had kind of documented them as someone who was exposed, so that worked our way to us, and we were able to, keep an eye on them. Yeah.
Thank you. Thank you.
So
Oh, go ahead.
I just had a quick comment. We often guide patients to the Secure Access Washington site for their own vaccine records, and it goes back quite a ways. And they always seem surprised to learn about it. But, you usually end up telling them, hey, it's the same site where you go to renew your license tab, your vehicle tabs, which surprises them, but hey, they can find what they need.
Believe that's one. There's also maybe an even easier way if you go to myirmobile.com. I think it links to the same database that has a lot of people's records. And, providers, clinics will often try to upload, if they notice that it's not, that record isn't in the system, but they have a record of it somewhere else. So they do try to keep it up to date as much as possible, but things get missing or that doesn't always happen, unfortunately.
Are there any other questions?
So Commissioner Mullen,
Yes.
with you never having the measles, would you rather have Chick-fil-A or the measles?
No.
The doctor is he's pondering.
Krager's pondering too. He's probably like Chick-fil-A or In-N-Out Burger.
So Dr. Krager, appreciate the time. We're moving on.
Yeah.
Okay, sounds good. Take care.
Thanks. All right, we'll go down to item B, approval of resolution 24-06 on the light and service of former Ford member Commissioner Bob Koch.
Yeah, so for those that are not aware, because I think Commissioner Cook had retired when Commissioner Mullen had signed on. And so many of us here at the Health District actually got the opportunity to work with Commissioner Cook on a regular basis and including in the pandemic. And so we were obviously sad when we heard of his passing, but then also at the time felt like, what can we do to help support his legacy? And so it was our request that we bring forward this resolution for your consideration and adoption. If you're okay with it, I'd like to go ahead and just read it into the record.
Sure.
Okay. So in the matter of proclaiming May 2020, oh, that's the wrong resolution. That's not the right one. Hold on, later. In the matter of honoring the life and service of former board member Commissioner Bob Cook, whereas the Benton-Franklin Health District Board of Health joins the community in mourning the passing of former board member Commissioner Bob Cook, and whereas Bob Cook dedicated his life to public service, including his time serving on the Benton-Franklin Health District Board of Health and as a Franklin County Commissioner. And whereas during his tenure, Bob Cook demonstrated a steadfast commitment to the health and well-being of the community, contributing thoughtful leadership, steady guidance, and informed decision-making that strengthened public health programs, protected vulnerable populations, and advanced health equity. And whereas Bob Cook was widely respected for his integrity, compassion, and his genuine commitment to listening to and representing the voices of his constituents in Franklin County. And whereas he took a sincere interest in the work of the health district, engaging with staff with kindness and curiosity, and consistently seeking to ensure that services met the needs of the community. And whereas Bob Cook's influence extended beyond his formal roles, leaving a lasting and meaningful impact on the Benton-Franklin Health Districts, its partners, and the many individuals and families served through its programs. And whereas his legacy endures the stronger, healthier community he helped build, and through many colleagues and community members who benefited from his leadership and dedication. Now therefore be it resolved that the Benton-Franklin Health District Board of Health hereby honors the life, service, and legacy of Commissioner Bob Cook and expresses its deepest condolences to his family, friends, and all who were touched by his work. And be it further resolved that the Board of Health recognizes and affirms that Bob Cook's contributions to public health and public service will continue to have a lasting impact on the community for years to come.
It was very well written. Very good.
When was he on the board? When I was on the board too, I don't think I remember him. Yeah, okay.
It was, yeah, I don't remember Commissioner Mullen when you started, but it was the term before.
2020. I ran against him in 2016.
Oh, okay.
Yeah.
Cause that's silly. I got elected,
Just for
you and I got elected the same year, 2020 stuff. So, okay. Yeah.
So I think Commissioner Didier is the one that may have served with him alongside him before all the changes and expansions, but a lot of the staff here, since we have a lot of tenured staff, myself included, knew him for the better part of 10 years.
I was at the city at that time.
And I got to work with him on the transport and on the RTPO, the Regional Transportation Planning, when I was on council.
I'll make a motion.
Very fine, yeah.
I move to approve resolution 26-04, honoring the life and service of former board member Commissioner Bob Cook.
Second.
We have a motion and a second. All in favor signify by saying aye.
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 Thank you. The motion passes. We'll move on down to item C, Benton County property complaint. And Aaron and David will be doing information update.
Yep, absolutely. It's 80, so long, but yeah.
Okay. Wow.
Hi.
Ah.
Alright, so, I'm Erin. How can you know me? This is Bailey Stenger. She's our supervisor for our solid waste and living environment department. And we wanted just to bring some information on a kind of an ongoing complaint that's been going on in Benton County, just to partially to bring it to your attention. I think the complainant has already reached out to some of the commissioners, so bring a little context, let you know what we've done and potential next steps. So I'm gonna just talk about a little bit of background, and then Bailey will talk a little bit more about the concrete steps we've taken that BFHD has actually taken around the complaint. So this complaint involves a property in the area of 49 that's in the city of Kennewick, so out in that area. They brought it to our office on the 16th of March. Then it came to us through what's called an ERTS report, which is an ecology report that gets filed in the ecology census. The complainant alleged that There is a property adjacent to their property where a construction firm has been dumping some unknown sourced fill dirt for months, and that is, his property is downwind of that. There were allegations that the fill dirt's being brought in with no permit, so there were some concerns, it sounds like, about the origin of the fill and concerns that maybe these are kind of their words. They said they had concerns about the unknown pedigree of the soil, concerns about the dust flowing into their property and whether it contained contaminants like lead. There was concerns that it may have been brought from somewhere like a former orchard land and could be blowing something toxic into their site. They were concerned about potential runoff from the site and that the activity was potentially happening without any permits. Those are some pictures. Part of them were provided to us by the complainant. Some were taken by our staff.
It's in the chat.
Yeah. Future interactions, we have a lot of interactions with the complainant. They added kind of as we continued having interactions with them, they've sort of added some things to their concerns. At one point they said they were concerned that there was a chemical barrel on the site. And so that I think triggered them to be concerned that maybe there were other chemicals buried in this pile of dirt. Concerned about harm from airborne contaminants, again, the grading and fill permits. They don't believe that any agencies are taking any meaningful effort to contain the contaminants that they're alleging may be in this dirt. The exposed dirt's not covered. And they're reporting that they feel that they're experiencing health impacts from what's happening here on the property. So, Bailey, do you want to talk a little bit about what we've done? And she'll talk a little bit about timeline and some of the other, we've connected with a lot of other agencies around it. We can talk about that.
Yeah, so we responded to the concern actually the day that it was received. We did a site visit at the time, observed that there was a lot of piles of dirt out at this property. Talked to the complainant about it and his concerns. He was very concerned about the dust flowing around, that there was no fill or there's no permits for this fill. So after looking at the site, I connected with the city of Kennewick. They did say that there were no permits at that time. So kind of long story short, that development a couple years ago had another property developer contractor working on it.
Can I just want to make sure on one point, because I'm
Yeah.
looking at the property. I just want to make sure and clarify for my understanding. Is this within Kennewick city limits?
Yes.
Okay.
Yeah. So city of Kennewick, not Benton County. Yeah. So the old property owners, they dropped out for whatever reason. New property owners came in, bought it, and they're the ones building it. It's going to be a single family residential home development. They came in and they did start bringing in dirt without the permits, and it was an amount of dirt that does trigger the need for grading permits and a CEPA evaluation. So I spoke with the city of Kennewick. We directed the complainant to Benton County Clean Air Authority, as that is dust when it is not directly connected to an actual solid waste facility is not typically my jurisdiction. So yeah, so we did that in some later communication. So initially we did not hear nor see anything about there being chemical contamination. It was more just the concern of the dirt itself. It was in later communication that he voiced that there was a chemical barrel there and he was concerned about items being buried underneath the dirt. So I did do a follow-up with that. We did confirm the presence of a single chemical barrel on site, which I think is in the photos somewhere. It was an all-purpose cleaner. It was one 55-gallon drum. I walked around the whole pile, didn't see any other chemical barrels, didn't see any other sign that something looked like it had been, like a lot of stuff had been buried there or other things being dumped. So I connected with the property owner. I asked them about it. They said they weren't aware of a chemical barrel. But I asked them to dispose of it properly and to keep an eye out for it in the future. They agreed. They said they would clean it up. So I came back out and I verified that the chemical barrel had been removed, did another circle around, didn't see anything that indicated more dumping had occurred since then.
And that was the next day, correct? So it's the
Yes.
contractor we contacted the contractor who's doing the development.
I think it might have been 2 days later.
Yeah, within a couple of.
Yeah, it was within a couple of days.
So if it was within city limits, did you happen to have conversations with the city manager? Typically, it goes, anything like this, sometimes there's a code enforcement violation, it sounds like.
Yeah.
And if there's a city code enforcement violation, typically it goes to the city attorney. City attorney then, as code enforcement go out there, they do their thing, then it goes to the board, a code enforcement board, and then they have some question.
It sounds like in terms of the
Do you know if
development,
it's
it's
gone that
been a
far?
couple of years, like it sounds like the contractor pulled out a couple of years ago, like she said, and so this new development, the city came in, noticed they were bringing in, over 3,000 cubic yards of dirt, told them to stop. So ostensibly they were working with them on
Yeah,
that.
exactly. So there was.
That's why I just want to make sure I understand.
Yeah, code enforcement was involved. They're the ones who put a cease and desist that said you can't bring in any more dirt until the grading permits has been filed, SEPA evaluation has been completed, and the city has given their approval on the matter.
They've also had them do some hydroseeding. They had them move the pile to the other corner of the property, so further away from the complainant's property. So there's been some action, I think, taken on the actual issue of the dust blowing. And then, like Bailey said, they let Bailey know that they will be soon filing the permits for the grading, and the SEPA environmental checklist should be going in. Yeah.
Which makes sense. I always saw I was liaison for code enforcement board personally, so I just trying to walk myself through this process. Okay, everything's going as it's moving along.
Yeah.
Before they did this, did you guys, or was the city like approving like a soils test to make sure that the soils doesn't have the bad stuff in it?
We don't do that.
Oh, look more of the city then, because I
And
remember doing that as a construction
yeah,
guy.
it
I've
sounds
done that
like
a couple
they
times.
don't as a standard do that. So the process would be if you're doing certain things, and in this case, bringing in so much dirt, it's going to trigger that SEPA environmental determination. They're going to fill that out. In that environmental determination, that's going to ask, I mean, you're familiar with it, but it's going to ask all kinds of questions about environmental risk factors, including where did you get this fill dirt from? What does it contain? If anything in that report triggers concern, then they may ask for testing. But if it doesn't trigger concern, then it's a move forward.
And it's also interesting, I'm on the Clean Air Agency board, to where they always know the permits of the projects, but they're usually always checking, hey, you're getting fined, it's too windy, you're not doing good dust control and stuff.
Off a keen right now.
Yeah.
Like this person themselves had sent the concern to Benton County Code Enforcement, which, that was outside the jurisdiction.
Yeah.
They sent it to Benton Clean Air. They've tried to connect with the city of Kennewick as well.
Yeah.
And so a lot of agencies, one of the reasons we're bringing you this here, it's not typically usual for us to bring complaints like this here. This for us feels pretty standard, and the majority of what's left is frankly outside of our scope. Right, we're at the point where we've had the hazardous waste that was identified on the site has been removed. That would be within our scope, solid waste.
Yeah.
They're later adding some concern around whether construction materials are being buried in this pile, but we have no tangible evidence for that. We have no pictures of that. We have no photos of that. It's all based on concern, right? And so I can't intervene and enact enforcement on a construction company based on a suspicion, right? I need some evidence to move forward on that. The other thing going forward is when they do the grading, if there's something buried in there, it would be revealed, right? We would be able to intervene if they are conducting activities that constitute a landfilling. So if you're putting garbage in that pile, covering it with dirt, putting more garbage, covering it with dirt, then that's our review.
Yeah.
And that should be revealed when they grade the pile. Otherwise, this is fully within, what's going on with the grading, the construction activity, et cetera. That's within the scope of the city of Kennewick. And so that may not be resolved, but that's not my territory. At this point, we have no other solid waste. We have no other tangible evidence that there's solid or hazardous waste concerns here. We think that the SEPA process is gonna happen. Do you want to talk about your interaction with CCP at all?
Yeah, so the complainant also sent in a concern to the EPA. So the EPA reached out to Ecology, which reached back out to me for a little more information. In talking with Ecology about it, they said their toxics cleanup program had they were the ones contacted, because if there was actually hazardous waste being disposed of on site, they would be the one of the key authorities on that. So but after talking with her and kind of running through the same thing, she said that for the toxics people, that they're gonna probably sit back and wait for the SEPA to come out as well. And if they see anything of concern in there, then they can step forward and either do testing or require testing as well for the dirt. So
Looks like the wind was in peril then, because it obviously didn't get dumped there. It'd have dirt around it.
yeah, I mean, I don't know how it got there. I know people dump a lot of weird stuff all over the place. So I mean, it was kind of a heavy, I mean, it's a big plastic barrel, so, but we'd also do have crazy winds. And so I don't know how it got there, but that was the only one I saw when I went through it.
So as you're giving us this information, is the complaint still coming back at you guys a little bit more?
That's part of the reason we're bringing it. Yeah,
Yeah.
last I heard, they had emailed some of the board members. They've escalated this up to the Attorney General's office, filing an environmental crimes report. And all of it, so for them, it sounds like they're being impacted, and whatever's going on with the actual construction activity may not be resolved, but in terms of our end and our scope here, I think that we've done our due diligence. We'll keep watching. We also received those SEPA reports, so we'll watch for that. We'll evaluate it. If there's anything that looks like it's going to be of concern, then we can work with our partners like Ecology to move forward some testing, but I don't see anything tangible at this point. So,
and I would just offer, he had escalated it to my level and for both of us to evaluate, which is in part why I was motivated to bring this to you guys today. So to make sure you were in the loop of that certified letter that was sent to the board, the conversation I had with him, very similar to the concerns that they expressed here on his behalf of, what our investigation process is, if we're being transparent about what it is, and just frustrations in the process, and that he's alerted multiple agencies. So I told him we would do our due diligence to go back, take a look, make sure that we've done a thorough review, and that we would talk with you guys about that as well to see if there was any feedback you had for us at this point.
And the board have any comments, concerns,
I
questions?
just say, like she said, anything that was buried, if there was anything, would come out when they graded it. That, like I said, the barrel. There's no dirt around it. There's no dirt on top of it. It didn't come out of a dump trailer. Because if it was sitting on top, it would have blown out on the highway.
we took care of it quickly, and I think the contractor we've spoken with a few times has been pleasant and working well with us.
Well, especially with this, so you're saying this is in the city of Kennewick, so city of Kennewick's the ones doing all the inspection, to where I'm kind of surprised that they're upset with the health district when it should be more of city of Kennewick, because again, they have inspectors coming out 2 or 3 times a week inspecting, compaction, foundation, all this stuff, to where it really, I think this is more on Kennewick than anything, because their inspectors are coming out every single time like, hey, why is that stuff here? That stuff, you're not bringing the right stuff in or whatever.
Yeah, I think in terms of how we approach the work, that's how we look at it too. I think sometimes they're bringing up the health impacts a lot. Right? They feel that it's impacting their health, and so they're looking to public health. And that's difficult sometimes, but when we're working in an area where we don't have authority there. We do, but we don't, right? We don't have a delegated code or a statute that directly authorizes us to work in this area. Then typically we would get involved if it's something that raises to the level of impacting an entire community, an entire neighborhood, a larger public health nuisance.
And one thing too with the wind, or with the wind and dust and stuff, they should have contacted the clean air agency, or sometimes the city of Kennewick will contact the clean air
Yep.
agency and have them come out and, hey, contractor, you gotta make sure you keep this thing dusted and everything.
And they did
Yeah.
contact them, and I can't necessarily speak to, the other agencies' responses. I know this person has expressed that they feel like they haven't received communication from other agencies, but they also expressed that about us to some others after I talked to them multiple times, so.
Carol?
Well, I just wanted to thank you guys for doing the due diligence and going, I think, above and beyond as a health department. But just wanted to know how we're gonna close the loop, because I don't want in any way for those people to think that we are in any way responsible for what happens next. And it sounds like you've given them the right resources, the right contacts. But how do we close the door on this? Because I don't want them to sue the health department, and they might be watching what happened out at, the logistics
Oh, yeah, no.
lineage. And maybe they're thinking, deep pockets, but I just want to make sure that we close the loop.
Yeah. From our perspective, we have already tried to close the loop.
Okay.
We've already let them know that we consider the complaint closed at the time. We have no further actions we can take or that we feel would be valuable for us to take at this time. And we always end that with please let us know if anything changes, if you have new, photos, evidence, videos, anything you want to bring to us. It's always on the table to reopen, right? We did do a little bit of extra investigation with talking to the city and ecology this week. And so we will likely watch for that CEBA paperwork to come through as well and evaluate it. And put that all up with the documentation we already have.
I'd also like to offer that since I engaged with him last on behalf of myself on the board, I'd like to send a follow-up with him and have a conversation to say, we did take this up to the board. The biggest question I think that he had stated in his emails was, would the board be willing to reopen the investigation? And so that's what I need feedback on from you guys as I come back to him and say, we went through it. Here's what I found. Here's the feedback from the board. I'd be happy to work with the chairperson to develop that draft message. Otherwise I can take the feedback now from you guys on what I can include in that.
So I had a couple of questions real quick. So that's why I wanted to ask, where's the city at involved? Still seems like they're going to be involved for a while, potentially. Code enforcement, I understand that portion of it, city attorney, code enforcement. It looks like you guys have done your due diligence. You've got as far as what you can do. You actually probably refer them to other agencies potentially. So I think we're good there. And until anything changes, I'm going to ask the professionals, what is your recommendation on what the board should do? I'm putting it on you guys. Isn't that good?
Yeah. I would consider it either closed, or I would say at least, at a standstill right now. Again, unless there's anything new that's presented, we're not moving.
So then Janae, if you were going to draft something like that, you probably want to use words to that effect. I think would be the best and wisest way to do it.
You took it to the board, we discussed it. It's closed.
Unless something else
Thumbs up, yes.
Okay.
Thank you guys.
Dr. Kwandi, did you have anything, or anybody else? Kathleen? Just want to make sure.
I'm good. Nothing. No.
Thank you, doctor. All right. We'll move on to item number 6. Let me look at it real quick. 6D, solid waste organics rule revision. Same people.
Sure. I'm gonna, if you don't mind, if I use it together.
Yeah.
Perhaps 30% numbers. If I have that, I'll share.
Yeah, I'm working on it. I'm during it in group chats, not the whole. Just the board members that are remote. You're going to pull it up on the screen, thank you. Well,
I would share it with those listening.
Janae, would you like to?
Okay.
Sure. Yeah, we didn't have it on like to give everybody here in person, so I didn't know if it was a.
Oh, yeah, no, I'm
Public.
thinking like, yeah, it's public.
Okay, I will work on that.
If you want me to-
It must be different.
I read the good thing.
Oh, you have a slideshow, okay, hold on, I don't think I have it downloaded. Alright, I thought that is the flyer
No, I did send you guys a slideshow. Is it on there?
Yeah. Yes, I'm sharing handout, give me one.
start with kind of a summary of what this is. So the WAC 173350, which is the solid waste rule, which is what governs our program, is undergoing a state rule update. This update is to support Washington's organics management law, which was passed a couple of years ago with the intention of, I think it's to be implemented by next year. And the goal of this law was to triple the amount of organic material that is being collected for recovery, which essentially means we're taking organic materials such as food and yard waste away from the landfill and putting it into some sort of recovery process, which is like composting, anaerobic digesters, land application, things like that. And that is to both reduce the amount of methane emissions and to recover those valuable nutrients that are lost and just throwing that stuff away. So the rule is being updated with the key goal is essentially to improve the diversion process for our solid waste handling facilities. In opening the rule, they also, do the common thing of just updating as far as, so it's not our, I don't know. I sent my PowerPoint to the comms, I'm sorry. Okay. I had pictures and stuff. It was great.
Do you want me to go?
I don't think, well, yeah, it should be. I mean, I submitted it to comms, so they should have it, but
I didn't see it.
I'm gonna look for it. I've got the handout, but no.
Yeah,
slide show.
it's okay. I can always do it off the top of my head. They're just missing the nice pictures.
Wait a minute if you want. See if she gets grabs it. What do you guys want to do? Do you want to wait? Or want to move on?
We have a nap break? Nap time?
Did you create those pictures? Did you go ahead and put it all together? Let's wait a few minutes for your. We'll see if she can go ahead and grab them real quick.
Okay.
You put work into it. Might as well see.
No worries. Any questions so far about organics law?
I'm reading through this stuff.
And just to clarify, this is a state, this is an ecology rule.
Yeah.
That's like,
And this is their rule change. This is.
Oh, yeah. Yeah, so, well, yeah, because if you just put it in a landfill.
We're trying to cover it.
I mean, there's
We're
lots of
trying to separate
nutrients and
the
good
two.
stuff in our yard waste and food waste, so it's like composting, it actually goes back into the environment.
We have it.
A useful thing. Oh, yay.
Okay.
It goes into your garden. Somebody's put it in. Yeah. We, Richland landfill has a composting.
In order to pull
So you can actually go there. If you want to buy compost by the truck full, you can go buy it by the truck full. I think it's actually a lot cheaper than going to illegally buying it if you need it by the truck full.
Come on. Hold on. I want it.
Sharing.
Here we go.
It was almost there.
I know.
Well, I wouldn't go to presentation mode. There we go.
All right.
Sure. All right, back on schedule. Okay, so I already kind of just ran through this first slide, but okay, other things that are the purpose of the revision. So supporting the organics management law was the main thing, fixing a little bit of problematic language, and then also addressing some emerging trends in organics processing. So I don't know if it's good for words. Yes, next slide. Sure. Okay,
Should work now.
all right. So I'm just gonna run through. It might not be on.
No, it's working. I just
Okay.
had to click into the PowerPoint.
All right, so just gonna run through some summary of changes. I'm not gonna deep dive into it, but just to give you guys a broad overview of what will be coming down the pipeline. So not every section was updated in the WAC, just a few of them, and all of those summaries I also have on this, page sheet, so you guys can have that as well. But so things that were changed: section 025, owner responsibilities for solid waste. The term owner was actually changed to entity, and there was some clarifying language put in around legal responsibilities This includes the management of rejected loads of organic waste. Again, the intent is to make the diversion of organic material easier for facilities. And a big focus of this was to promote smaller businesses and startup companies to have an advantage, because one of the biggest barriers to composting is the amount of contamination that ends up in those loads and that waste in that type of stream. And so by shifting the responsibility kind of upstream, it takes a little bit of the pressure off of the smaller businesses downstream, gives them a bit of advantage. There's also a requirements put in around recycle bin labeling and disposal bin availability. It was kind of random, but just threw that in there. All right, some definitions. So section 100 was, which is definitions, were updated. There were additions made for clarity and for the new processes that were put in there. And if a definition was removed, if it was determined it was no longer needed. So an example of one that was added was worm castings or vermicast, because in this update, they determined that vermicast was, before it was just put under composting, but it's become such a big thing and they realized, I mean, it's not exactly composting. So they separated those processes and created a definition for it. This was one of the biggest changes. So they added in this section, subsections 215. This is for organics materials pre-processing facilities, also known as depackaging facilities. This is creating actually a whole new permit type. And so this would be for facilities that are focused on removing contaminants from the organics waste stream. So they might be part of an existing facility or they might be an independent facility. But it puts some regulations around them, most specifically with them having contamination limits for their outgoing products. Sorry, and I was just going to say with that too, as far as like, not that I imagine you guys all have this whack memorized by heart, but as far as like a permit section, there's nothing really crazy about this one. It is very kind of cut and paste from the other sections. So for these next few slides, I'm going to kind of just touch on, instead of like going section by section, because there's a lot of repeated themes, I'm just going to touch on the main themes of things that were changed. So one of those is the contamination limits. Again, this was one of the big drivers of the rule change, is making sure that we get contamination moved out of the organics for processing. And this must meet a max contamination limit of 4%. With contamination being defined as what that facility cannot take. And so there are some facilities that are more advanced and can handle like things like biodegradable plastics, and some facilities that can't. So
how does that, yeah, I mean, I don't know if this would, how does the Richland waste disposal site, is that affected by this in any way?
Yeah, so they'll be affected. Yeah. First, like it's how much they're allowed to take, or like the contamination that is they bring in, or that goes from their like front spot to where their actual compost is. As far as I know, they just do it by hand. They just have people go through and pluck it out. However, right now they also only accept yard waste, like clean yard waste, and so they'll have people check for stuff that comes in on their the curbside service, but they don't take food, which is where like you get really the majority of contamination. And honestly, a lot of their contamination also comes from just when it's windy and the fact that it's at the windfill and or landfill and the wind picks it up, the trash. So
it'll affect them somewhat, but not.
Yeah. A lot of it is more like, again, this is more geared to like smaller businesses where, say you have like a small startup compost here and they want to take from some other business, like their waste stream or food stream. It's making sure that depackaging is taken care of ahead of time, because unless you're doing it by hand, it basically requires these really fancy, giant, expensive machines that our small composters can't afford. So
thank you.
Okay, other highlights, there was a lot of changes around permit exemption and permit exemption types. The reason being is, again, just organics has evolved a lot over the past few years. Things that weren't common practice before are becoming a lot more popular, such as slaughter waste has become a big thing, composting slaughter waste. So they added in some stuff around that. So for example, in composting, they actually added in exemption types for things like meat processing, food processing. And then they also changed around some volumes and reporting requirements. I'm not going to dive into those because it's a lot of little number minutia that's boring, and we'll talk about it at our workshop. So, but the other one that I do want to highlight because it has affected us and hopefully won't again, but there's the chance, is an exemption created for handling carcass disposal in case of mass animal mortality. So say such as when you have 1 million birds who have died from avian influenza and your facility wants to compost them, it does create a specific exemption for that, which is really helpful because it puts in there kind of what they're able to do with that, as well as who, like, the reporting and who the deciding authorities are. So there's less kind of confusion there between us and state and all the other agencies that are involved in these type of responses on, who decides where that goes.
Bailey, can I highlight on that too, that affects us, but also we affected that rule. So I've directly spoken with the staff ecology who drafted this rule, and our events in Franklin County largely inspired them to make sure that they included something in the rule to be clear that red tape was, as minimal as possible in these events to make sure that it can go forward without needing permits and lots of stuff. So it really moves the hands of the approval into the state veterinarian and WSDA, and authorizes things like land application and just a much smoother process there. So
in the case of the avian flu, though, when you compost 1 million chickens and them had avian flu, there's no danger to the environment.
Composting sites is amazing. Yeah. So there's a really very particular process that USDA has established around composting specifically for avian influenza.
Okay.
So if it meets certain temperature thresholds, I think it's 140 something degrees for certain days on end, then you can deactivate that pathogen. So it's very, very closely monitored. There are actually 2 USDA certified composting specialists in the state. One of them works for WSDA, one of them works for WSU. And they have to be on site to oversee the composting and to sign it off back to the farm. So it's very heavily monitored process. Yeah, but I was just wanted to highlight that because I think that's it's an after action thing we made sure we did something with after our event, and our being a squeaky wheel paid off.
A woman of influence.
Well, it was a lot of us. It wasn't just me. There was a lot of us. So we're really, really glad to see that one being involved in the rule.
And I think we're just fine not being the ruling authority on that. We just want to know as a courtesy where they're going. And so we pestered them about that too. We're like, please make sure that they're notifying us. So, and that's really it. So as far as, again, as the rule, there's a lot of just like basic language updates, like updating rules and stuff like that. But those are kind of just the main highlights. So any other questions about that?
You want me to?
Yeah.
Okay. So, all right. So that's the second half of this. So that's the state rule change. While we were kind of in our gap waiting for Bailey's presentation, I mentioned it, but I'll mention it again for people online. The significance of this rule is that our agency holds a grant from the Department of Ecology to run our solid waste program. 100% of our funding for that program comes through this grant. And there is a clause in that grant that you have to have a locally adopted ordinance that adopts this rule by reference in order to hold those funds. So anytime they update their rule, we have to update our rule. So we have a local rule, solid waste rule. It's Benton-Franklin Board of Health Rules and Regulations number 6. It is much shorter than the last rule we brought you. It's only about a page and a half. And there are only 3 really minor provisions in that rule that are different than the state rule. So it will be nothing like the on-site sewage rule that we worked on the last year or so, but we do want to bring it to the board. Through that process of the septic rule, we've been really thinking about how we can best do environmental health rules with the board so that we make sure we have time to sit down, go over information that's sometimes more technical and needs a little bit deeper discussion than we could realistically do in a regular business board meeting. So I've connected with a couple of my counterparts from across the state and just kind of looked at how others are doing it. And I wanted to present a couple of ideas or options to you all. What we would like to do is we'd like to, for the solid waste rule, since it's very, very small, we'd like to sort of test this out and test drive, maybe doing a rule workshop outside of this regular business board meeting. So we would propose for this particular rule, we could probably get it done in 1, maybe 2 sessions, but probably do it sometime in the summer, July, around that time frame. Couple of options. So this I would consider a smaller scale rule change. So we could have that rule workshop conducted with the full board. So it would be an open public meeting, right? We could actually vote on action. We could get everything done after the rule workshop. We could also include 1 or 2 industry reps if we want. May not be necessary when, especially when rules are maybe smaller or there's just some small administrative changes we need to make. We might not need to bring in industry, but that's an option. Or we could, some of my counterparts will do, and what I found actually in our historic board meeting minutes, what we used to do a long time ago, like early 2000s and 90s, was to conduct a board workshop without a quorum. So have representative sample of board members, right? Maybe it's 3, whatever is, what's a quorum for us, 5? So smaller group that would meet, dig a little bit deeper into the rules, come to consensus and come up with some recommendations that we would then bring back to the larger board, so that the actual business meeting is more of a, here's our recommendations and let's, kind of vote and move forward. Sounds like that's how our board used to do things in the 90s and early 2000s. Granted, we had a larger board then, so we had the cities involved. So those kind of are the 2 main options I wanted to present and see how you felt. I know it's extra meetings, which everyone loves.
No, I think Commissioner Mull and Commissioner McKay and a couple others, I think they're
he volunteered.
willing and able.
Can we do that board meeting at Disneyland?
No. Chick-fil-A? I can compromise Chick-fil-A.
So what would the board like to go ahead and do? Any feedback?
I like her idea of just having a group bringing it forward.
I agree. Yeah.
Want to volunteer?
Yeah.
Want to volunteer?
If they want to bring it back, I'll be here.
Okay, you know,
Yeah, and
I need a couple
Well,
more.
good thing Chick-fil-A is just right here, so we can eat Chick-fil-A.
they say we don't necessarily need to decide on the who
Yeah.
today. I think the model is what we're
Yeah.
looking for to figure out, and
Yeah.
we can test it out with this one. There will be, we have other rules. We have a groupie drinking water rule. We have the on-site sewage rule. So these are going to come up from time to time.
Yeah.
So it sounds like a lot of my counterparts will just have more routine workshops. So we're kind of maintaining and keeping our rules in good health. And it doesn't end up being, a big endeavor every time we need to undertake this rule.
I would just say, when I was on the council, we would have workshops and we would bring in the subject matter experts. And I think that in cases that I have no idea, what this really means in terms of the chemistry and all that, that's who I would always look to as the subject matter experts, to have them at the table. So either pro or con, to make sure that you're getting a good flavor of the opinions that are out there from the subject matter experts, and particularly people that are being impacted by this rule.
Yeah, and that would be our intent, is if we're doing a larger scale rule, like our on-site septic rule, we're still going to be doing an industry group.
Yeah.
That may happen before the board workshops then, so that we would then bring the industry recommendations forward. But for solid waste, as I mentioned, our local BFHD rule for solid waste has 3 very minor provisions in it. That's it.
Yeah, so maybe
Really
we just, why don't you just go ahead and you guys can go ahead and figure it out, see who wants to go ahead and do that group. That doesn't matter. I'm willing to do whatever we need to do to get it done.
Okay.
We'll make it.
We'll work on that, and then our staff will be the one to facilitate and do the research and bring everything over to you. Okay.
Any other comments, questions, or concerns to the board members here in reference to this?
Hey, I'm really sorry, Bailey. I totally missed that one. I got the handout, but I didn't get the PowerPoint. She sent it.
Oh,
I just didn't follow through, so I'm sorry about that.
We're good. We're gonna go ahead and go to item 6E, Mental Health Awareness Month presentation. Swetha, no, I'm gonna feel bad. Is it Swetha?
Right here.
I want to make sure, Julie, Kelly, and the Chihuahua students are gonna be doing the presentation.
Thank you. So I'm Kelly Harnish. I'm the Healthy Living Manager here at BFHD. And we just want to express our appreciation for over the last several years, the support the board has given for passing the Mental Health Month resolution for May. This year, we thought it would be really valuable for us to add a few extra elements to the resolution presentation. So as mentioned, we'll be hearing from Swetha, who's one of our data epidemiologists, and she'll be presenting some mental health data. And then we'll also hear from the students at Chihuahua High School about some work they're doing in a mental health counseling class. And we'll hear from Julie on what the mental health subcommittee is doing for Mental Health Month. So that's what's happening today. Just wanted to make sure I introduced how this would roll out. Thank you.
Good afternoon, everyone. Good afternoon, board. Thank you so much for this opportunity to present. My name is Swetha Nanapati, and I'm a data analyst epidemiologist here at the Benton-Franklin Health District. I'm here today to take you all briefly through some mental health data in our community as part of our today's Mental Health Awareness Month discussion. The goal for me here today is not to go into an in-depth analysis, but to talk about a few key patterns and data points that help us understand what's happening in our community at the local level, that is in Benton and Franklin counties, so that we can identify opportunities for prevention and intervention. Before I start talking about the data, I do want to take a moment and acknowledge that we'll be briefly touching upon suicide and data related to suicide. I just wanted to share that up front so everyone listening here has a moment to prepare, and so that we can all approach this topic with respect for individuals, families, and the people involved. So let's start off with our first slide. What we're looking at here today, so that's our first slide. What we're looking at here today is the data from 2019 to 2023. So the number of adults who have reported poor mental health for a period of 14 days or more, that is for 2 weeks straight, during the past month at the time of survey collection, has gone up from about 3% in 2019 to 12% in 2023. That is over a course of 4 years. This shows us that more people in our community are dealing with ongoing stress, emotional challenges, or mental health challenges. Also, I wanted to quickly mention that this data is consistent with what we're seeing at the state level, and this is not an isolated pattern. And the important thing here is that these concerns don't just show up during adulthood. They start early during youth. And as shown by the data from the Healthy Youth Survey, the latest year data that we have available is from 2023. 1 in 3 students in 10th grade report feeling sad or hopeless for extended periods of time. And nearly half, that is about 45% of students in grade 10 report feeling anxious for long periods of time. And in many instances, these emotional challenges in youth can carry forward into adulthood and affect their long-term health. While mental health challenges can affect anyone in the community, our data is showing us that not everyone experiences it the same way. There has been a 96% increase in people experiencing poor mental health among Hispanic residents. In simpler words, we could say that poor mental health has almost doubled over the past few years among the Hispanic residents. We also observed that when we look at more severe outcomes, such as deaths due to suicide, we see that men are at a higher risk of suicide compared to women. And as we focus on mental health awareness this month, we are working to better understand these differences and how we can bridge those gaps. When we take a closer look at deaths due to suicide over the period of 2021 to 2024, we see some fluctuations year by year. There was a peak of 58 deaths in 2023, and while the numbers have gone up and down, the numbers have relatively remained steady. It's also important to note here, I'm not talking about 2025 data because it's still preliminary, and which is why we're not using that number for reference. When we look at who is most affected by suicide, the highest mortality is among adults who are aged between 45 and 54.
I'm just curious on this. 45 to 54, do you know what the reasoning behind that is? Have they any comments on that? I'm just curious for that age bracket, or do you know?
There's no definitive reason as to why we're seeing deaths among that particular age group. But from a general perspective, it could be because people reach a level of crisis during that particular age period wherein they feel when they feel on the verge, or where they come to a breaking point. That is probably the age group which is why we're seeing the deaths concentrated among that age group.
I could add that Julie has kicked off a recent subcommittee with a variety of community partners around suicide prevention. We have a youth suicide prevention committee coalition, but that obviously focuses only on younger age groups. And so with our data, we see, really our risk is in our middle and older adults. And so this subcommittee is addressing that. They're actually meeting next month at the Veterans Affairs Office, which is great.
June. I'm just kind of curious to see what that age line that is. Oh, okay. Thank you.
So let's keep going. So when we look at who is most affected, we saw that the highest mortality is among adults aged 45 to 54. And before we move on to the next slide, I wanted to take a moment to remind ourselves that behind each of these numbers that I'm talking about is a real person, a family, and the ripple effect that we see in our communities. The next slide is really important for us to understand where we actually have the opportunity to act and prevent. Our data shows us that emergency department visits for suicide attempts and ideation are happening far more frequently than deaths. This shows us that people are reaching a point where they need support and they are showing up for care, which creates a real opportunity for us to intervene and connect them to the support that they need. What this graph you're looking at shows emergency department visits data for 2025. Teenagers and young adults have the highest rates of suicide-related visits. When we look at differences by sex, we see that ED visits due to self-harm behaviors are higher among women than men. This shows us that women are more likely to seek help and they're more likely to seek emergency care in times of distress. So the data on ED visits leads us to an important question. What happens after someone reaches a point of crisis? Are they able to get the help and support that they need? This is when we need to look at access to care. According to the Behavioral Risk Factor Surveillance System data, which is a survey that helps us understand people's health, behaviors, and access to care, only about 16% of adults have reported having access to mental health care, whereas 3.8% of adults at the time of survey collection have seriously considered suicide over the past year. So I was talking about earlier how for many individuals, mental health struggles don't just show up during adulthood. Research has consistently shown that mental health is shaped up by experiences during formative years and adolescence. Before we talk about this graph here, I want to briefly talk about what adverse childhood experiences are. Adverse childhood experiences, or ACEs in short, are stressful or challenging experiences an individual can experience during childhood that can affect one's health later in life. This could include any form of abuse, such as emotional, physical, sexual, or it could be neglect and dysfunction in the household. So these experiences are linked to poor mental health in adulthood, chronic diseases, and social challenges over time. This graph here may look a little packed, but the main takeaway is that we're seeing more students in grade 8, 10, and 12 who are reporting higher levels of these experiences. And fewer students are reporting no ACEs or zero ACEs as compared to a few years ago in 2019. So just to like summarize all of the information that we're seeing here, what we're seeing is that mental health challenges are increasing and they're starting earlier during childhood. And people are reaching crisis points, but they're also interacting with our systems before the most severe outcomes. This gives us an opportunity or a window period, you could say, wherein you could improve access and support prevention efforts as much as we can. And at this point, I'd like to hand over to Julie Chacon, who will talk about our mental health awareness activities.
Thank you so much for giving us the opportunity to share today. I'm Julie Chacon. I'm a behavioral specialist for the Benton-Franklin Health District, and I'm here on behalf of the Mental Health Awareness Subcommittee. And that's made up of a bunch of community partners here in the area. This May, we're coordinating Mental Health Awareness Month activities, and the flyer included in your packet highlights those coordinated efforts and other ways the community can get involved. We're also excited to have youth participating this year by reading the Mental Health Awareness Month resolution, which recognizes the importance of this month. At this time, I'd like to invite students from Tijuana High School to share their class experience and read the resolution.
Hi, I'm Megan Rhodes. I'm the mental health and counseling teacher at Tijuana High School, and I'm going to hand it over to my students. This is Anne Marie, Anita, Sydney, and Rupika.
Good afternoon, everyone. My name is Anne Marie Underwood, and I am a student in Miss Rhodes' mental health and counseling class at Tijuana High School. In this class, we learn about mental health and well-being, both for ourselves and others. We discuss common stigmas and stereotypes and how they impact people, while also building practical self-care and help seeking skills. We also learn about our emotions, how to label them, sit with them, and work through them in healthy ways. We study the history of mental health and how perspectives have evolved over time. We complete projects to better understand mental illnesses and disorders. We explore local and national mental health resources and learn how to advocate for ourselves and others. We also explore careers in the mental health field, as many of us are interested in helping others as a profession. As part of our course, students may participate in QPR suicide awareness training, which teaches us how to recognize warning signs and support someone in a crisis. We also hear from guest speakers such as first responders, treatment center disorders, and prevention specialists. We analyze media and complete projects that promote positive mental health and wellness. Lastly, we created a mental health wellness retreat at the movie theater, where we invited community partners to share information, strategies, tips, and resources to help us be our healthiest selves. We participate in yoga, engage in community partners, and then have lunch together. Our community partners included Pasco Prevention Network, Wellness and Recovery Center, Mirror Ministries, Lutheran Community Services, Take a Break Tri-Cities, Lotus Yoga, Tri-Cities Treatment Center, Go Team Therapy Dogs, Challenge Tri-Cities, and Fairchild Cinemas. We feel extremely fortunate to have the opportunity to be in this class and to share with you today. Thank you so much. Hi everyone, my name is Anita. I'll be reading the first part of the resolution. In matter of resolution number 26-03, proclaiming May 2026 Mental Health Month in Benton and Franklin counties, whereas mental health is an essential component of overall health and well-being, and mental illnesses are common and treatable conditions that affect people of all ages, races, cultures, and socioeconomic backgrounds. And whereas each year, millions of Americans face the reality of living with a mental health condition, and now more than ever, it is crucial to reduce the stigma around mental illness and promote open, compassionate dialogue. And whereas Mental Health Awareness Month has been observed each May in the United States since 1949 to raise awareness, provide support, and advocate for policies that support individuals and families affected by mental health challenges. And whereas promoting mental health and wellness leads to stronger communities, healthy families, and more productive workplaces, it is vital to ensure that those who are struggling feel seen, supported, and empowered to seek help. And whereas we recognize the importance of community support, education, and access to services, and commit to fostering a culture of understanding, inclusion, and care for all individuals.
Now, therefore, be it resolved that the Benton-Franklin Health District Board of Health does hereby proclaim May 2026 as Mental Health Awareness Month in the Benton and Franklin counties. Be further resolved as Benton-Franklin Health District Board of Health. We also call upon interested parties in Benton and Franklin counties to commit to our community to increase awareness and understanding of mental health and provide the steps for our citizens to take and protect their mental health and the need for appropriate and accessible services for all people with mental health conditions.
Board, any questions, comments this time before we go ahead and make a motion? Mr. Mullen, do you have anything?
No, just good presentation. Thank you.
Yeah. Good job. I'm glad that you're addressing it, especially at the high school level.
Should we do it?
Oh, go ahead.
Can we chant, let's go Chiawana? Let's go Chiawana. Good job, girls. That was awesome.
So real quick before we do the motion, I want to say thank you guys for coming and taking the time to do this. I know it sounds like you probably have personal reasons you want to do this as well as, doing it for the community. So I appreciate that. I know that this is something very important to me personally, as well as what we do here at the county. We're going to have a grand opening for the Columbia Valley Center for Recovery that also addresses mental health. And I know that would be a great program for both Benton and Franklin counties, as well as my goal is to enhance that further for our youth. So I want to thank you guys very much for the resolution, and we will work very hard to support you and everybody else here within the county. So thank you guys.
Thank you.
All right, that being said, do I have a motion?
Yes.
Yes, sir.
I move to approve resolution 26-03 proclaiming May 2026 Mental Health Month in Benton and Franklin counties.
Do I have a second?
Second.
I second.
All right, we have a motion and a second and and all in favor signify by saying aye.
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 And the motion passes. Thank you guys very much. All right, we move on
Do you
to.
girls like that? Do you guys like the Fairchild Cinema in Pasco?
Yeah.
Built up.
You did? That's really cool.
So the Queensgate one, Steptoe one, or the one in Kennewick too. So I've done and I know Jeff Fairchild, the owner, a good guy. But
But you also know my sister Mamie.
oh, no way, that's your sister?
Yeah.
I did not know that.
Yeah.
Yes. I didn't know that.
Yeah, can we, is that okay?
Can we do silly faces?
I don't care. We are sharing this.
One
with the
serious.
task force.
Yeah.
No rabbit ears, okay?
Yeah, I got you.
Do a regular one then.
All right.
Silly face.
1, 2, 3, cheese. Okay, and then more silly face.
Now silly faces.
I don't know, so I work with them.
Yeah.
I didn't know you're the sister.
Yeah, so that's why we do our wellness retreats there to be like.
Yeah, that's
Yes.
You'll see, we're not boring at Benton County, that's for sure. All right, we'll go to item number 7, launch of environmental health assessment survey. And Aaron, you're back up.
All right, this one will be quick though. So, Director Aaron Hawk today from the Benton-Franklin Health District. Here with a really quick announcement. We're excited to announce that the Benton-Franklin Health District has launched its first comprehensive environmental health assessment survey. So this is kind of an environmental health version of what we hear of the community health assessment survey. So this is a community-wide effort to understand how local environmental conditions affect our health, our quality of life, and the regional economy. The survey was launched last week, kind of quietly online, so we could work out some bugs. It is available on our website and on social media at this point. We will probably follow up as well with board members and sending a flyer that has QR codes on it
really encourage you to take it yourself if you're living in our community and share with colleagues, family, and friends to take the survey. The survey aims to gather input on things like air quality, drinking water, climate impacts, lead, pesticide exposure, waste management, like you heard Bailey talk about today, and the general environments where we live and work and spend time, like parks and restaurants and pools. And responses we hope to shape our future policies, our investments, grant seeking, where we put our priorities. It's really aiming to hear, this last piece of the project is aiming to hear from the community what their concerns are and what they want us to be paying attention to. So the survey will be open through July 2026. So it'll ideally close in the end of June. And anybody, residents, business owners, employees, anybody who lives or works within Benton and Franklin counties are encouraged to take the survey. So that's my quick announcement, and I will follow up with more information with all of you to hopefully share and take yourself. Thank you.
All right, thank you. We'll move down to item number 8 for approval of vouchers. Do I have a motion?
Oldest to youngest.
Oh, that would be me.
Thanks.
I would move that the Board of Health approve the payment of vouchers number 21-2026 through 29-2026 in the amount of $1,110,100.05.
Second.
We got a motion and a second. All in favor signify by saying aye.
Aye.
Motion- Thank you. Motion passes. We don't have no executive session, so we're gonna go down to item number 10, closed session, review and discussion of collective bargaining for SEW 42.
Board, myself, and Aaron. Okay.
All right, we are out of closed session. No decisions were made. Before we go ahead and I announce the next meeting date, Commissioner Mullen, anything that you would like to go ahead and say, any comments? No? Carol?
Oh, I do. So just a reminder that Tri-City End of the Year is at the end of the month. And I noticed that you guys haven't signed up because I get to see who has signed up. So in the event that you're interested, I know that Senator Nikki Perez is going to be there and Representative Bernard. Matt Banky had to drop out. He couldn't come, but we love to see elected officials there, and I'm a way to support the community. And I know who the person is, and then I think you'd really enjoy it. I think it's going to be a good program.
All right, thank you.
Yeah.
Can we do fast food restaurant of the year, Chick-fil-A?
All right. And any of the board members online, I really can't see the names all the way, so I thought it would just be a generic. Any comments?
No, thank you for the good work.
Thank you, sir.
We're good.
All right.
Marcy,
Kathleen?
Commissioner Didier.
Oh. Anybody else? You said Commissioner Didier's on there? Commissioner Didier, any comments?
No comment.
Thank you, sir. Anybody else?
Katie and Marcy on mine as well.
All right, I think we're good because no one else is trying, so.
I think,
Yeah.
Kathleen?
Nope, no comments.
All right. And I see nobody else with their hands up or mics off, so we will go ahead and go and announce on item number 11. The date of the next meeting will be May 20, 2026, and this meeting is adjourned. Thank you.
Thank you.